So we get our nurse for inside the house, Nurse Stephen Okpeti, in the intensive care unit practitioner. And I should say, as in the intensive care, you don't see some people will be saying malaria don't knock better like this, carry them with shaky body, land inside hospital, and they don't help take care of all those people them well. So it's that chip with me inside studio, Kajad, to follow me discuss the matter concerning malaria and sickle cell vaccine with WHO. Don't mark good. Good morning, Nurse Stephen.
Good morning.
I like the twinkle in your eyes and the smile on your lips. Thank you very much as you join us. So we'll talk about this vaccine matter now. With the kind of things the one I don't face for intensive care unit, what we the work, especially make an act from the experience now. Concerning especially those people that will get sickle cell when they don't get breakdown or crisis, the way they carry them come. And then plus maybe children that we don't deal down with malaria, the way parents go carry them with high fever and all that come. How you think say this vaccine matter now go use, be news? This news of vaccine go change anything for inside this matter?
Yes, what happen be say for here, you get plenty things where they affect modern healthcare problems or values that all those things are supposed to add for our life. So one of them be say there is this thing where they call stereotype. People still they paint vaccine. Say they evil. Say if they take vaccine, then go die, or take vaccine, then go turn to bishikat.
But would they take vaccine right from when we small? Should all of us take yellow fever vaccine?
Now waiting with the con they see now. We don't know whether na technology or computer age where people be saying then they fight each other for social media. They go on spoil other person show. One drug company may be sponsoring anti-vaccine so that people when go take them go plenty. So if by the grace of God, as this vaccine don't come, so another thing where would they look at be say make it accessible to the poor masses, because as it be like this now, it never plenty.
Okay.
It never plenty, but unlike the malaria own don't take away day.
Okay.
But
would they give them? If malaria own don't they give them? So why wouldn't they give them?
They now. We never ordinary pertussis and all those ones. They sometimes
because I know say when they born Pekin new, they give list of series of vaccines so they give Pekin different ones. I don't remember them now. He don't take away I face that level and all that. So now this malaria only see I'm like say go follow for those series of vaccines where they supposed to give children from birth.
Yes,
that's what it's supposed
to be a mandate because this vaccine, this malaria vaccine, what thing they do be say they support our immune system.
Okay.
You get, be like say a person where don't take the vaccine, no get chances of breaking down to malaria. When you just when you just take the vaccine finish, you go sleep under bridge for Jelagba. If
mosquito bites you well.
If mosquito knock you back there, you go break down. But waiting this vaccine gonna do for you, if you don't take them, your symptom go dey reduced. All those problems where it's supposed to cause you, where they bring people malaria, they bring people for ICU. You go see say all those ones no fee happen. But it's more beneficial for children.
Make I even ask that question. Why is it important for us to start this vaccine, this malaria vaccine, from children instead of adults them?
Because say their immunity never strong. So that's why when you take them as early as possible, the vaccine go down already circulate inside the person as the person they grow. Because what vaccine does is that it confers immunity into us against a particular disease. So if children take them, it would be more beneficial to them because of the symptoms that it causes and the severity. Because
their body still fresh, so you come build into their system to help them protect them against the malaria. In case you just joined us, we talk with Nurse Stephen Okpeti, in the intensive care unit practitioner. And we talk about the malaria and sickle cell vaccine so far. How the team won't use change the narrative for inside intensive care unit, or probably how it will use help our children them. And you don't tell us, first of all, we make it be say the children then are the first people where they start with them, because they them their immune system see they learn work because they're still young. So when we start with them, since the immune system almost they blank, so it go help build their body, they go grow together. Their immune system system will grow together with their body, and the vaccine go help make their body kajad. You don't contact this sickle cell own. You see them as a big relief because some sickle cell people they go through a lot. Oh, when they through crisis here, not be small gbege and all that. So some people when especially those who don't get money to go through the cell stem transplants and all of that. How you see this sickle cell vaccine now to use help people where they will get sickle cell?
You know, for me and we will be say we see them on daily basis and you know see the suffer way then they suffer. You know when they get that crisis, I feel say it could be like say heaven don't come on earth for them because you know say for sickle cell there is this adage that says you don't go back to yesterday. So the deed is already done. So nothing else will do feel help them. But for this vaccine now. For those ones who don't get money to do stem cell transplant and all that, now this vaccine now be their hope. Now be say, you know, say they go live longer. Now be say the suffering within they experience, you know, those joint pains and all that because that is what this vaccine does. You know, not be like say it go change their genetics, but waiting the vaccine.
You know, go turn your AS or SS to
yes.
AA.
You know if you do that one. So, but the vaccine itself, waiting being work now, be say make them know they suffer all those things within they suffer during their crisis, and you know you can also make them get engaged in many other things because you know say because of crisis they know they do plenty things to avoid that crisis. So this vaccine are one of the things we be say like this now. They, in fact, many of them go they rejoice, and I feel say another challenge where they go feel face now accessibility and whether you will also be affordable.
Okay. Okay.
But now when that one reach,
when we reach that bridge, you go cross them. Okay. Now you know say malaria on the fear me well. Sake of say we hear say malaria now in the cause death pass for the world. Even HIV. Never keep people for Africa reach malaria. Cancer self never keep people reach malaria. We hear say different number of people they die every minute for inside malaria, for inside Nigeria. But bad as it reach, so would they sabi take malaria matter for granted? You know even consign us. Small thing do you now? You don't, your head don't the ache. You say, I think I get malaria. You go buy drugs swallow. I think I get malaria. You go buy drugs swallow. So this malaria vaccine now, if the thing will finally reach adults them now, which kind help it be say it go bring for inside our healthcare system?
This malaria vaccine, there are a lot of you get a lot of change we supposed to bring. Like we did so now, we know to Nigeria will not get enough insurance to cover for people's health, and the shortage of healthcare staff and healthcare equipment. Where we say we make some people, some hospital, you go be like say nothing they happen there. You understand? Now you can't go couple with the fact that say malaria and waiting we go fight for our home instead of coming to the hospital to occupy space because of malaria. Now, if people take this vaccine now, you understand, for them to fall sick of malaria become hard. You understand? So you go now give room for other things where we say doctors supposed to look after for hospital, where you know people where they sick well. So one thing very important we say we go stop the you know the cases of malaria in the hospital will reduce because of the vaccine. In
fact, this one where you talk to the cases of malaria go reduce. Make I quickly even ask you, what's in be the volume of malaria sickness people want to see, especially for your intensive care on a daily basis? Well,
you say if you have 10 patients in a clinic, 8.5 to 9% of them will test positive for malaria. Then the ones where they carry come inside ICU now, those ones where don't they complicated, where they don't neglect the malaria, they know they take better drug or all those fake drugs, and at the end of the day, some organs of the body has now been tampered with. So before you know what is happening, you start having those cerebral malaria that the person go they talk off point, and people will get belly too. You know, it also affect them more, and the child where they carry for belly. So all of these things now be the reason why people will suffer, so they come find out say, get waiting they fit do. May they help people with malaria.
All right, thank you plenty as you sit down with us to yarn this matter. It's not easy for you to wake up for morning like this, saying a straight to our studio, now you come sit down with us. We appreciate you well because we know the stress will be to walk around for Lagos. We'll not take you for granted. Thank you plenty. You get any final word where you get to talk before we wrap up the segment?
Well, the only thing why I want to talk, we say, as I know say some of our government officials, they see us, they listen to us. My own be say, may they try waiting they will feel try, just like they did for COVID vaccine. Make these vaccines come, they with us. You know, then another thing is that we are no longer investing in education of healthcare personnel. So I go to plead with government and the individuals where be say they fit. May then they support we will be healthcare practitioners to do at least, even if it's one course, one advanced course. This thing will help us to, know what thing we do more better than before. Then the other one is for our people. They say a teaching time saves nine. So my word be say for our people, I beg with the beg owner. May on fit go they take vaccine if you come. You know go turn to BC cat, you know go turn to transformer. If you take vaccine, you are saving yourself and your family.
Me self don't take COVID-19 vaccine now. I mean, day so now not be pussy.
Even me, I don't
be cat.
So.
Thank you.